Okay. So we're going to be live here in a little different social media
Okay.
with my friend, and I wanted to practice saying your name. Heidi,
Mastichetti.
say it again.
Mastichetti. Say it however you'd
Mastichetti.
like. Yeah.
Mastichetti. It's a great name.
Spaghetti.
It's a great name. So I want to share with the listeners, and as I said, because it's not the typical live where you can come and chat with us, we're going to speak a little bit, and then I'm going to leave Heidi's information because she's just one of these people that I get to meet in the last 5 years that I've been doing these lives. There's just such a desire to want to share and help and assist and guide and inspire and educate. And, I'm this bridge that can bring these people to you. And so I feel very blessed to be in this position. I'm humbled. And Heidi is just so excited to do this. So now I'm
Yeah.
gonna speak to her, and she'll be on email or she'll be on Messenger. She's not a coach, not doing this for any reason, but just her healing recovery has been inspirational and really, really um, one of these stories that's got to be told. So Heidi, I want to just say how we met. Now, I have to say that I'm on Facebook a lot, and I kind of sometimes nuzzle into these other Facebook pages that are not so much body mind or TMS or neuroplastic. And I kind of I don't ever want to be like I'm selling something. I'm just about educating. And I kind of jump in there with some information. And I always say, if any of you are open minded, mind body, interested to hear another point of view, and that's how I met you on one of these pages. And I am so blessed and that you responded to me. So just share from with our listeners. I prefer that you kind of talk about a little bit like the timeline, like what happened and you started to notice pain, and then you began to do this, this, and this. And that way we can get a feel, because your story is our story.
Yeah. And first of all, thank you for finding me. And I think that you obviously found me because when I'm in some of these other groups, I tend to suggest more of a body mind approach. And a lot of people don't know about it. And unless they kind of find out about it, they don't know. So my story was I got lucky like that. In around 2019, end of 2019, beginning of 2020, I happened to have some pelvic pain. And, it was in several different areas. And I had, at the time, I went to a gynecologist who was probably around the age or a little bit younger of Dr. Sarno. And in fact, Dr. Sarno probably had died in the last few years or whatever, in the last decade. But I have a feeling he may have been aware of his work. And the way he came at me when I told him about my pain was like, we're going to get to the bottom of this, but we're going to use a few different tools. He didn't really come at me with just like, let's take a medication, or it was more, I would advise you do therapy. And then it was, he rolled up close to me in a chair and he said, "Did you have any trauma in your life?" And I felt so cared about that even then that moment I felt there was hope. And so he said he had seen women like me, and I'm sure there's men out there, get better by using a few different things. It's not just one thing, but like getting therapy, looking at the past trauma, looking at what's beneath the pain that you might be fearing, because I was really scared. And that's a big thing with TMS. I was horrified, like, oh my God, I've got pain and it's in these weird areas. So I was super hyper focusing. And without even knowing too much about TMS, I set on a journey of just I started learning about restorative yoga, really simple, because, those of us that are in pain, we can limit ourselves, like can't do that move, can't do this move. So restorative was really easy. It was like get a bolster, get a blanket. You could do it on YouTube. And almost every day I was consistent. I would light incense and I would have like a flow I did maybe twice a day for 20 minutes. And I was consistent. Consistency was a big piece. And then I would listen to also a lot of positive podcasts. I found other girls, in this case, it was women that were like me who had some similar issues. And I think one of them might have been called the Beehive. And I started listening to a lot of these women that had overcome pelvic type things. Some had completely resolved, some still had some issues, but were living their best life. And so I kind of wanted to strive to stick with the winners. And then, of course, I did what was suggested, which was therapy. I went to therapy and I dealt with
So
some of these.
what I mean, I want to just interrupt, which I do
Sure,
that. So you were having chronic pelvic pain in your
sure.
pelvis, in your female areas,
Yeah,
and
yeah.
it was
And like TMS, it could move.
right.
It
And
could move.
you went to your gynecologist, and that's how this started.
Yep, yep, yep. But instead of being like, oh, it's, your uterus or some kind of diagnosis, he gave me no diagnosis, just kind of gave it the umbrella term of pelvic pain, which I like. And also, I'm going to use certain terms. Sometimes I don't like the word pain. I like to go with the word sensation, because even the way the brain processes a word can change how you feel
Yeah,
things.
100%.
So the sensations would change, but I would say with time, with therapy, even though I didn't know of TMS at the time, within about 6 months, everything disappeared.
Amazing. So here we are. These women are not going to bump into a man like that, which was, I'm going to say lucky, but those people do exist.
Yeah.
There's a Scrivener and there's a Hanscom and there's a Clark but they're few and far between, and they're not going to be your typical doctors. And yet more and more doctors are understanding this. So this is the future. But right now, if women aren't bumping into that and they're not getting relief from the medical model, here is an option. So you can say to them, even if you are seeing a doctor who's giving you medication and you are in pelvic pain floor therapy and you're not getting better, this is an option, and it's not new age. Because your pain was real, but you knew it was coming from your
The
brain.
psychological.
Right. And so the fact that he mentioned that, you could have been like, this is a crock of shit, doc. Come on. But you also received it. Someone else would have said, I want medicine. I need to be treated. Something's wrong with me. I have pain. But you figured it out that the pain was real, but the cause was in your brain. How'd you figure that out?
Well, I figured that out because I realized what came before is the trauma or something usually sets it off. What got the ball rolling? Like right now, the coach I'm working with tells me to be curious. Set a timer for 3 minutes. Be curious. What might have come before the nagging? Let's say it goes in your hip. It can move. Like now, I deal with more and I'll be honest with you, I had a few years of kind of here and there. I have been to the point, just so everybody knows, that I have had pain manifest after a very stressful period at a job working in special education, which Dr. Schechter, who, if you research, is another kind of well-known doctor of TMS, had told me, a lot of the type TMS personality types, we are kind of martyrs, we are kind of perfectionists, we do want to be benevolent and help, but at what price? And I started to notice my body, funny enough, all my TMS started right around when I went into working in special ed. And, you might be getting hit, bitten, kicked, that kind of thing. And, it goes in with even family trauma and PTSD. There were a lot of things. And in certain ways, I'm glad I went down that avenue. I'm actually grateful for what's happened to me because it allowed me to actually address the underlying things that those like you help people with, and now I'm actually, Dr. Schechter had said, do things, like know the things, like I do things that I know help me even perceive it differently, whether it's a walk in the sunshine or bathing in nature or sitting on a wise rock or leaning on a tree. I've done somatic therapy at night, doing a nice meditation. And there are times where I've seen myself let up for like 7, 8 months, and I still may have some symptoms, but then like I'll go through something really stressful. And then I kind of have this few days, and then it could manifest in a new area. Let's say your foot or your shin. And I go, I don't just say that that's TMS. I've been learning from my coach to be curious about it and to go deeper. What's underneath that? Could it be anger? Could it be fear? For me, what often happens is because my sensations can be intermittent, where in the morning I could be fine or they show up later in the day. So I can have pretty good days and such. Um, I find that it can be scary when something random occurs after like a year of not having it. Let's say it comes back like a phantom thing, that you almost kind of get a little more whipped up. So to be aware, okay, like I kind of say hello, good to see you again, but don't go too far down the rabbit hole. Like, you found me on that group. I try to sometimes, like, although I want to help people in groups with diagnoses, I also am careful because I find that when you go too far down, like oh my God, it's in my shin. Let me look up all these things it could be. You're like feeding your brain that, and your brain will follow. It's such a powerful thing.
Yes.
Whereas when you can kind of say, hey, this is psychological, you've been really stressed out. You're a new mom. I have a 15-month-old. Some nights I don't sleep too well. Sleep is a huge one, I think, for those of us with body mind, to then just kind of be good to myself. Like, okay, Heidi, like, you didn't sleep very well last night and you might be feeling it, let's say, in your hip, but this will go away. This does have an end.
That's
And,
bringing calm. You're bringing
no,
calm and safety to your brain.
yeah.
I
Yeah,
just
because it does go into fight or flight.
yeah.
And let me tell you, I am a intense person. I know this about
All
myself. And I remember,
TMSers are strong and sensitive. And again, to
yeah,
our listeners, chronic pain is not normal. And if your pelvic pain started for no reason, even if you had an injury, the body heals. I mean, we say,
I agree.
God forbid you got, you fell or you had an accident or you had some impact there or some major trauma there. The body heals over and over again. And I remember I forgot about this because, this is, I think, my 240 or 50th broadcast. But the first broadcast 5 years ago was with a woman, and she went to 25 doctors. She had such terrible pelvic pain. She had this sort of constant arousal, which was painful. I mean, can you imagine how the nervous system was creating that sensation? She went to 25 different doctors. She had surgery, and her daughter was like, and nothing happened to her. She didn't even have that kind of bad trauma, but stuff happens. And for whatever reason, you're living with some chronic psychological pain. Her daughter says to her, Mom, just try out some meditation. And she's like, okay, what the heck? She lies in this with this hypnotherapist, and the woman just does a little bit of calming, and she has no pain. And she doesn't even think, she's like, what? The pain has to do with my brain? And all that to say is, and she's better, and she's now a coach. All that to say to the listeners is that all pain is in your brain. Acute pain is processed here, chronic pain is processed here. And the more chronic it gets, the more it becomes a habit and it's processed in the same place as fear and anger. And that's why we understand that chronic pain is an emotion, and that's how we can, recover. And so I just wanted to preface that, and to meet someone that has been, struggling with chronic pain in a very sensitive area. It's not for us to judge, but if there's nothing structural or organic, there's no reason why people have to suffer. And what we're talking about, you and I, Heidi, is a scientific method of healing. So share more with the listeners about what you did besides having that door open from that doctor and
Well,
then
just
figuring out.
just so that you brought up some good things, I just to give some calm and peace of mind, especially to those with pelvic pain, which I'm telling you, I know it's in a weird spot. So one thing I learned, because I have a PT that's amazing that does body mind stuff, and she really wants her clients out on their own, thriving without having to always come and see her. She told me pelvic patients specifically will obsess even more due to the location. And I want you to kind of just know that that can happen, and to not like think too much that, oh my God, because it's in my butt or it's here or there or in the front of my pelvis, my uterus. And I'll tell you, I was one of those people at one point, even after this whole period I told you about in 2020, after I'd been through a lot of stress and I got full body pain. I went to a level of, a lot of us do this, desperation, where I saw a famous doctor and I had him do a laparoscopic surgery. And he literally found things that really had, I thought I had endometriosis. All these, I went like nuts. He didn't really find anything. And God bless his heart. The nice thing was it ruled out the physical. But I will tell you, I have had doctors say, well, you have a nerve that's bulged at L5S1. But here's something I'll tell you. There's people with herniated discs that don't even have sciatica.
Well, I'm a
So,
chiropractor for 40 years, so I will back that up
you know
1,000,
what I mean?
with plenty of research. And it's
Yeah.
sad because it's a doctor's responsibility to say it's not coming from the disc because I have a bulge and you have a bulge, and we're all
Yeah.
going to behave
I don't
differently.
believe, yeah, like my tailbone. I'll be honest, you brought up a good thing I want to tell other people too. We can sometimes obsess, like during this time, I'd taken a fall on my tailbone in the last few years. And it does not surprise me, I'm just going to tell you, that my sensation relocated itself to my tailbone after the fall. I do not blame, but I do not play a script that it was the fall. But I do believe that those of us with TMS, our bodies will like go into like a cycle. And I don't put a timeline on it. I know I have good and bad days. I know I've come a long way. I know that when I took the fall, it kind of hurt my left hip. But what I noticed is when I was pregnant about 6 months in, that's when things like, why would a fall 6 months later cause me? That's how I knew this is very TMS. And I've just been doing the best I can. And as of recent, thanks to you finding me, and then also this wonderful gentleman named Matthew, who's very kind on the TMS wiki and the page on Facebook, I've been able to do what Dr. Schechter said, which was, there might come a point, and I'm going to recommend this to people, you coach and stuff, that you may want to go a little bit deeper and get a coach. Because I have a therapist and I can talk my trauma and all that. But really, I think a coach, and I just want to put this out there, I think you'll know when you need one. And what I think is nice about it is you guys can really help. I have ADHD, so it can be really nice for someone to give me some structure and some tools that, it's really hard to go all over the internet, but you guys might know some very specific, like a hypnosis or something to do to really help me. So I really want to advocate to people that there are a lot of people like you out there that can be very helpful. And I found myself in a place recently where I was getting kind of stressed, and I was like, you know what? I think I'm at that point Dr. Schechter suggested where I kind of need somebody,
Yeah.
and so I've just begun, and so my journey continues, and it's changed and it's evolved. And I think you put it on my thing, I can live with it. I just don't want to live in it. I don't want the
Love it.
sensation to
I
be my
love it.
life.
And that's the way out. That's the
Yeah.
neuroplastic method. And more people on all these information, people are healing because they accepted it. They became aware that they had body mind pain. And let me even explain it easier to people who might not be in the neuroplastic mind body world. Your brain is living in a state of fight or flight. Your brain is creating these symptoms because it's perceiving a threat. And the threat doesn't exist. There's no fire, there's no lion, but your brain believes, and it's protected because it's a lizard brain. We all have the same lizard brain, and we all respond and react to pain differently because of our childhood, because of where we came from. My mother didn't have a thermometer in the house, so it was like being sick was no big deal.
Yeah.
It was like no big deal. And then my kids were like, can't you give us attention when we're sick? Because that's what they wanted. It was
Mhm.
like, and so the whole thing is like you understand, and then different things happened in our childhood. So we don't blame, we simply understand our relationship with our body, our relationship with health. We can have a health anxiety, not have physical pain. We can be uncomfortable with sickness and death, even, and not have physical pain. And I think what you were saying is like this was your wake up call. This was what kind of woke you up. Or I was talking to someone, I forget when I was talking to someone, but it was more like sometimes we have these pains and it's our doorway into learning something about ourselves. How do we relate to our body? Do we how do we relate to our thoughts? So this is kind of like how people can get well by seeing that they're not a victim of this pain. There's a reason for it. There's a way out of it. And I'm all about integrating medical and holistic. This is not about one or the other. You want to, take medication, fine, but let it work and go live your life. Don't be chronically ill with pain and believe there's nothing you can do, because you and I are meeting people all the time that are healing from everything. So it's hard for me to hold back, because this is not like Jesus walking on water. These are people that are healing all kinds of chronic pain.
Yeah, and I just want to say, like, I support people, and it's totally okay to like take medication, but my goal is always reduction. And I've been really lucky that, like, for instance, I did go to the lengths of getting a spinal cord stimulator because there was a certain medication I was on. I wasn't taking a lot of it, but I do want to care about like my liver and stuff. And so I do believe it works. I have it on the very lowest setting, but I just view it as one of my tools. And quite honestly, I think when this one dies or whatever happens, the stimulator, I probably wouldn't get one again, because I truly think that although it helps stop the pain loop, like if you're in a bit of a loop and you feel like you can't, and you could turn on like a little there's mine's like non-tingling and tingling. You can do that. I do notice in like 5 minutes, it does show the proof that it's TMS. It'll do something, and then when it stops, it's like it disappears. So it is nice that it's a tool. It is nice that it's a non-medication. I feel major, not that I was on a ton, but I'm very thankful for that. But do you want to know the truth? I think it was just a step to where I'm at now. And if I could tell anyone anything, I don't think I wouldn't advise you for or against one, but I would say the most powerful thing that I think has been the reason I've reduced my meds is that I practice something called comfort is king. And so, like, for instance, if you're feeling a sensation like sitting's kind of hurting, I have really fluffy pillows and really furry blankets. And those things are great distractions. I might lay back like this. And I don't even use ice anymore. And I find myself, I'm driving sometimes 7 hours a day. And I've retrained my brain to think, okay, yeah, I feel you. I feel you right now. Like I might feel you at 5 p.m. or 11 a.m., but I don't write a script like at night my pain comes on, even though sometimes that could be true. I also know that sometimes it could happen after a night of no sleep at 11 a.m. And I just kind of say hello, and I do things that make me feel good. What might make you feel good? Well, do you want to go stand and walk around? Do you want to sit on a nice fluffy pillow? If sitting on a hard chair is hard, I'm not saying go make yourself do that. But I do actually sit a lot. And I want to tell people there, especially with like issues that, might drive them nuts, like sitting, you can do it. You can sit, you can stand, you can walk. And I found like, although I'm not hiking as much as I used to, and I know I'm going to be able to do it one day because I'm putting it in my brain, I'm getting there. And I'm doing things like swimming a lot and trying to work my core and continuing to do physical activities despite like maybe feeling a little something, because I know that I'm teaching my brain and retraining my brain that this can be done.
Yeah, absolutely. 100%. It's so true. You really are. Look, you're a warrior. And I think anyone with chronic pain is a warrior. And I think it's hard for people not to feel like their body's against them. But we know in this field of neuroplasticity and brain pain and chronic pain that the body's protecting you. Again, it's not punishing you. And all doctors understand chronic pain. They understand neuroplasticity. They don't get a lot of training in it. And this sort of bittersweet thing is they don't treat you. They treat the symptoms. So they treat your pelvic pain like everybody else's. And you need to find someone who's going to treat you. Because when
Yeah.
doctors find out what else is going on, they're able to help you. And this
Well,
is,
and I'm really thankful that I got really lucky. The engineer for my stimulator is body mind centered herself. And she said her most successful clients use body mind techniques. What is I'm really lucky. My PT, her most successful clients use body mind. They get back on a reformer
wow.
that maybe they did an at home Pilates reformer. And she says, Heidi, I've seen people completely come out of like tailbone and this pain. I said, they get on the reformer, even get a cheap one and they just do it 15, 20 minutes a day. And it's almost like retraining your brain. And then she goes, they're also watching their stress, and I've been really blessed. Even the doctor that put in my stimulator, I know I found something online where he wrote about the pain loop. So he even, I think, has some of his clients journaling and doing stuff like that. So I've been really blessed that a lot of the doctors I go to have kind of a multidisciplinary way of looking at things. And I think a lot of them are kind of impressed with me because, a lot of times they're having to teach people these things, but somehow I've been lucky enough to have professionals that knew enough about this that then I started researching Sarno, looking at Joe Dispenza and people that kind of have this body mind
Yeah.
approach. And I can't tell you enough about listen to positive things. Reading can be hard for me sometimes unless I'm treating my ADD, like with medication. So if I can't read, I get it on Audible. If it's too hard for a long, long time to listen to something, listen to a short clip that's 15 minutes, even like a what do you call those talks online that people do? There's a lot of body mind people that go on TED
Podcasts,
Talks.
TED
Yeah,
Talks.
and they're like 15, 20 minutes. And like my whole like perception of my pain, let's say I'm in a bad spot, vanishes listening to these people. And some of these people say, hey, I still feel it, but I'm living my best life. Hey, that's great.
Yeah.
Like I just want to live my best life, and hey, if I can be pain free, great. I have a lot of what I call it just good days.
Right.
And a lot of it's attitude. I have an attitude of gratitude. I see it in the TMS groups. How many people say 5 grateful things every day that you're grateful for, to start thinking positive? Because I think a lot of us go down that rabbit hole and we become negative and we dwell, and then I start following people on Insta. We go down that hole. We follow the people that all they want to talk about is, doctors gaslighting them. And yes, that can happen. But at the same time, are you almost looking for something, with your mind that's negative? Like some people may find me kind of woo woo, but honestly, I am living proof that this does work. Talking to people like you and getting coaches like people like you does work. I'm
Yeah.
sure it's like when I saw something on Dr. Sarno when they pulled like 5 files of his clients out to see like if things worked. Almost all of them were either better or out of pain. So whatever he was doing, which was pretty simple, just asking people how they were and getting to the bottom of things, it was working.
Mhm. Look,
So the proof is in the pudding.
yeah, and look, so, you know, we're going to leave your email. We're going to leave maybe your physical therapist out west where you're in California. We're going to just leave her name. We're going to let people know there's resources. I give everybody a complimentary consultation, and my coaching is I teach you to be the doctor. I teach you to be the therapist. So I'm about you taking care of yourself. And I think that's an empowering way. And most of us coaches are doing that. But I'm very specific about you learning this because it has to be a language, and you started to speak the language, and people can begin to speak this language. It's a language of understanding your brain pain, and that this pain is not dangerous, and it will decrease. You can't make your pain going away a
And I
goal.
think people like you can really help people like me, because what happens is I'll get to a spot where I'm like, I'm doing better. I've got this. But then I'm telling you, it's like alcoholism or anything else. You may not be like cured, but you can be recovered. And what I mean is you got to keep doing it even when you're feeling better. Don't stop, like maybe doing the journaling or the, looking at, because it can creep back in. And I'm not trying to scare people, but I do think it's important to have a ritual. And I've noticed with most people that are doing really well, they continue doing the ritual. Like, I know, I just want to leave with this. I know a woman that a year ago I was speaking to, and she was still dealing with tailbone pain, and she'd come out of full body pain. And I'd met her on the TMS Facebook group. And she had told me now, either it's gone away or she doesn't notice it. She said one day she just sat down and it's gone. That woman was so regimented every day with things, nature walks daily, bathing herself in nature, meditation, mindfulness, reading good books, constant positivity. She completely rewired her brain. So it's completely possible.
Yeah, and you don't have, even if you have a full-time job and a family, you
Yeah,
can, there's always time in the day, and little steps, baby steps. There's a lot of free information, a lot of resources that I can share with people, a lot of things you can do on your own, a lot of support in our community. And I'm just privileged each week to meet someone like you. And, you know, pelvic pain, it's funny that you said that. It is rather popular.
right.
And you don't have to have a sexual trauma to have pelvic pain. It could
I absolutely agree. It could be some other kind of trauma.
just be
Exactly.
planted right there. I mean, autoimmune disease, different parts of the pain. We don't understand why always it's in certain parts of the body, but it is your brain. And, we can do a very careful diagnosis that it's definitely TMS. Sometimes it's not, but the majority of chronic pain is. There's lots of information on the Physio-Psychological Disorders Association that's run by all these medical doctors and one Dr. Schechter. And so I'm just reaching out to people just like you are. And, when there's a will, there's a way. And they say, if you can't find a way, you'll make a way. And you're determined. You use that ADD and that determination and that drive to serve you. And that's why you TMSers and you people with mind body pain, you people with pelvic pain and chronic pain are smart and sensitive people. You're not weak, and so part of it is also to, in honor of Michael Jackson, like looking at the man in the mirror and just saying, hey, what do I need to know? Who do I need to know? And part of it is a relationship with yourself. And I know that it does sound woo woo, but that's what it comes down to, because if you can't heal a body you hate, and so I want you to leave another couple of powerful messages. So
Well,
journaling, mindfulness, meditation,
yeah, and I
exercise.
really want to recommend, I didn't do it back then, but especially to those with pelvic, because I know it can be so, you can feel so desperate. Girls, guys, whoever you are. I have had people write me who've seen that I've been positive, like literally, I feel like they're almost at the brinks of death. They're so down on themselves. And they get all those terms, they get scared, like pudendal neuralgia. They go down that hole. I highly recommend maybe getting a coach like you. And the reason I say this is because the sooner you try to get some help, and sometimes it is, if you're that far down or you're that down, find someone that can help you, because people like you have seen people recover and get better. And, the longer I feel like you don't treat it and you just go down the rabbit hole of
Yeah.
diagnoses and constant, I'm telling you, you're gonna hit a wall, and I don't want to ever see someone I think in one of my groups did take their life. And, you know, if you can get help, find somebody else,
And
someone like you.
yeah, and there is more and more doctors that take insurance. I mean, I take insurance through
Exactly.
through
Exactly.
teletherapy, but there are a lot of doctors and coaches, and I can give you that information from the pain reprocessing therapy. They take insurance, they're social workers, they're nurses. I mean, I bumped up an organization of a woman from Canada who helped her pelvic pain, and she has a whole huge pelvic health support, lots of information. I think just we don't always believe it's out there. We get tunnel vision, we get scared, we get stuck, you know?
Yeah, and whatever you do, if you got TMS out there, do not be afraid when it's totally typical, like mine, to relocate, whether it goes full body or whether it goes as a twitch in your hand or a pain in your wrist or a pain in your hip for a while. Just don't hyper focus on the location. Like, and sometimes I go on the TMS wiki and I look at people with completely different issues than mine just because I don't want to get stuck on my sensation where it's located. And I just look at their positive stories. And even if they're still dealing with it, sometimes I write these people.
Yeah.
Know that as a group, as a team, like even the Facebook group, the roundtable, I highly recommend even
Yeah.
getting diagnosed with TMS by someone like Dr. Schechter. It
Yeah.
wasn't that expensive, and he's a very genuine person. And when you see him, he even comes with a full video that I'm still not done watching a few years later.
He worked
That's
with
very
Dr.
educational.
Yeah, he worked with Dr. Sarno. And
Yeah,
many of us doctors are, we can diagnose you. And there's also,
yeah,
there's quizzes you can take to decide and see if you have TMS. There's written by doctors on the PBDA website, which I'm going to put all these resources. In fact, I list all these resources. I have them all on email, but I'm going to list them. I'm going to take this Zoom. I'm going to put it on the Facebook. I'm going to put your email. If somebody wants to
yeah.
email you or messenger, can I give them your Facebook? And you're like
Yeah,
this,
whatever
like
they
this,
need, like, and if you're, I will recommend, if you're a pelvic patient seeing a pelvic therapist, the number one thing I would find that my PT says is a good PT needs to be teaching body mind thing number one first and foremost, and a real PT wants you to be well on your own. And it starts up here. It's not to just get you coming back constantly. It's to get you back. I hadn't been in a year, and I'd gone to see her once or twice, and I'd say after 2 sessions, I'm already better, because half the time we're doing the talking about, well, what are we going to do to actually treat this? What are you going to do at home?
beautiful. No,
Where does it start?
to
So
empower you, to empower you.
yep,
Yeah, well, you
yep,
are some cheerleader. I mean, you are some cheerleader. I mean,
yeah,
you really are highly motivated, highly inspirational. And
yeah.
we did talk a few weeks ago, but I'm just so happy to hear how it unfolded for you. And okay, you were lucky. You had a few people that really helped you, but I think I think when people are so far down, they've got to wake up and say, I'm not a victim. There is hope. And maybe I need to come out of my comfort zone. Maybe I'm a little addicted to this pain. And we all get addicted to our fear and our anger. This is all very human, you know, living with pain, healing with it's all very, it's not, pain. And this is, I wanted to say, acute pain, remember, pain, we think, oh, something's wrong. I have pain, but not this kind of pain. This is chronic pain that's coming from your brain and not anything physically wrong in your body. And I know it's a little bit of a challenge with your doctor who's diagnosing you and labeling you and telling you you have this. Well, this can heal. He can, he knows that. He knows that. Every doctor knows the body heals over and over and over again.
And that's why I'm really lucky to have the one I have. There what has been no like real like diagnosis. It's just been like, okay, we'll try this stimulator and it'll help you in these areas.
Yeah.
But I mean, he's told me a lot of people like with coccydynia or whatever you want to call it. He doesn't really do this, but he said a lot of it he found like it came out of like COVID and stuff. A lot of people were coming down with
Well,
things.
of
And then it
course.
would just like he said a lot of it's almost like maybe I'm paraphrasing, but psychosomatic, like it's
I
almost
don't
like
like
it
that. Like
comes
that word
on.
is
You know what I
mind
mean?
body. That word is the same word as mind body.
Yeah,
Dr. Hanscom, who's a spinal deformity surgeon who
yeah,
teaches work, he calls it threat safety. Your body is in threat and you need to bring it safety. You need to connect that your fight and flight mechanism is protecting you. And this is all part of this amazing education that you can heal. And, you know, it's like the doctor in you. And my logo is the doctor in you, the therapist in you. And I'm really about you learning this. And I think, Heidi, you know, you'd make a great coach, but right now you're doing amazing, raising a
Yeah,
child,
and
taking care of yourself.
I just want to say, don't beat yourself up. I know a lot of TMSers, I don't want to say purists, but like it's okay if you're taking an antidepressant. It's okay if you're treating with your pain with some kind of like, medication. There's a bunch out there that are narcotic or non-narcotic here or there. Like I get that.
Not
Like
here to judge. We're not judging.
we're not going to judge, but I can tell you, you can see reduction and you can come off of stuff and you will be surprised what your brain can help you do.
Yeah, Heidi, you're amazing. And I'm really happy. I'm sorry we had some technical problem, but listen,
Nah.
we're gonna, we're gonna put the Zoom up on the Facebook page. I'm gonna send a copy to you to share with some of the women.
Yeah.
And you and I are on a mission, so our mission's not over.
Yeah.
So
Yeah.
have a great rest of the day. It's my nighttime, and
Yep.
we're gonna be in touch.
All
Thank
right.
you,
Thank you so
dearest.
much.
All the
Have a nice
best.
one. Bye,
Hey,
everybody.
honey.